So the first question is for Susanna. What digital incentives actually work to change behavior in the young adult population, do you think? Have you seen anything that has had a particular impact in the young adult population?
That's a great question. You know, the problem with the field that we're in at this point is that we have anecdata. We have anecdotal evidence. We are starting to see some clinical trials. I actually don't know of a study that focuses on young adults, and would welcome it if anybody knows of anything. One of the journals that I look to and that I would immediately turn to search for such a question is JMIR, the Journal of Medical Internet Research. That is a cutting-edge journal that that publishes very quickly. The Journal for Participatory Medicine is another journal. It's a newer journal that I would look to for evidence of this. But it's definitely something that we need to see more of.
Thank you. Okay, and the next question is probably for Maya. How do patients know how to trust a site, or how do they know what credible information is?
It's also a great question and really tough. I mean, we heard that you don't have to have a degree or really any knowledge at all to be online and be spouting all kinds of information. I think that for the most part, that's where hospitals and physicians that are recognized in the community can play a very large role. If you come to a website and it's a .org or a .gov is a much safer bet than a .org. But in general, if it's a hospital that you're familiar with in your area, if it's a physician like Dr. Val that you can look up and read a bio about, and there's just some extra steps you have to take as a patient if you're looking at information and reading, what someone is spouting as facts. Google the person that it's coming from, Google the organization it came from, and again, the more that local hospitals and local health agencies are online, the more of an opportunity a patient has to identify it more quickly.
And Erin, I'm going to interpret this question a little bit. I think the question is, if you believe there's a trend in healthcare companies starting to look towards having faces for their brand because of the whole, sort of personalization of interactions that we're seeing in social media, is that going to drive companies to seek out actual individuals that will sort of carry the brand and sort of interact with the consumer in a way that feels more personal because it's an actual individual? Are you seeing that trend, and do you think that might happen?
It's a trend I'd like to see. I would love if clients would be willing to take the personal nature. I think all of us are more likely to feel listened to when it becomes when it becomes an actual person. We saw some examples with Maya's presentation that there was an actual face behind it. It's not just the hospital that was responding to them, but it was somebody on behalf of the hospital. And whenever we are conducting outreach, I really push a client to say, let there be one person who is really strong in this space. If you're going to use someone let them be involved on a daily basis so that they are interacting as themselves on behalf of you, and let them become that voice, because it doesn't mean they have to actually have their personal life get intermixed with it. But I do think that it's a nice way to have a face, and that they can actually be someone they can continue to go back to for information.
I have one more question for you, and then we'll go to the audience physically located in this room. It was noted that NAPH is really a consortium of safety net hospitals, and the thought was that some are probably more engaged in social media strategies than others, and they wanted to know, well, what made the difference between one hospital and the other? Was it an individual that sparked the whole thing, or was it a team strategy, or how did that work out?
We talk about this a lot among our membership. I think the folks that got into it first have larger communication staff. It really comes down to time and people, because all of this, you got to be on there, you got to be updating things on a regular basis. And you notice a lot of my examples were academic medical centers, because they've already got you know, the university itself likely has a presence online, and so it's a nice pair for the hospital, and they've usually got a medical school and all sorts of other things that are coming into what they're doing online. But it also depends on the goals and the strategies of that particular hospital. I know that Boston Medical Center, which is a pretty large public hospital in Boston, they have a nice size marketing team that their whole goal is cause marketing, and they do a lot of outreach online to get people to, you know, support the hospital. So it's sort of a different goal than engaging patients. Not that they don't do that also, but again, I think the strategies, it depends on their goals, really.
Thanks. Okay, Brooks, let's see if we've got questions in our audience. Oh, we do. Oh, okay, great.
To add to what Susanna said, there's a study in pediatrics last year where they took teenagers who were given transplant recipients that were teenagers, and half of them they put into a trial where they got text message reminders about taking their transplant medication. The other ones did not get the text message reminders. And in the text group, the rejection episodes fell 80% in a 90-day window. It was really cool. So there's at least one good sort of published trial about it. So that was last year.
Thank you.
And who had a question? Do you see a trend that more people are demanding information on researching and are more researching facilities, whether they're university or private, being better represented by social media?
Well, I can speak to the general trend, and then maybe you guys could talk about specific examples. We are seeing an increase in the percentage of people who are looking at hospital reviews and people who are searching for specific doctors, searching for information about specific facilities. And so that is a possibility that people are doing that shopping. The reality, unfortunately, is that a lot of people don't have a choice. And so they could look at these hospital reviews, but if you're stuck in a rural area, then you might not have a choice. But the possibility is there to know what you're getting.